Hi, everyone. Welcome to the Aesthetic Edge by TIG Advertising. I am your host, Tracy, and in addition, we're being joined today by Tal Raizer, a nurse practitioner at Plasma Med Spa. Welcome, Tal. Thank you for hanging out with us today. Um, yeah. Do you want to tell us a little bit about yourself before we start our conversation here?
Yeah, absolutely. So my name is Tal. I'm a nurse practitioner. I started my nursing career in emergency medicine. I went to Johns Hopkins and I got a job working in inner city Baltimore for a not-for-profit hospital. It was very difficult and I learned a lot. I ended up moving. My husband was in the Navy, so we moved around quite a bit. I moved to Colorado, Virginia, got my master's, then my doctorate, became a nurse practitioner. And then I moved down to South Florida because my husband was stationed down in Homestead. And as a nurse practitioner, I worked most of my career in orthopedic surgery. So when I was doing orthopedic surgery, we worked a lot with plasma for joints, muscle, tendon pain. And so when I decided that I wanted to go into aesthetics, I wanted to focus more on plasma and regenerative medicine and aesthetics and wellness in that matter. And so when I crossed over into aesthetics and then decided to open up my own practice, that's why I decided to open up Plasma Med Spa.
Great. That is that is impressive.
Oh, thank you.
You were on quite a journey there. That was phenomenal. Um, so you talked a lot about plasma, and that ties into a lot of PRP therapies and treatments, right? Um, can you elaborate on the range of regenerative treatments you offer along those PRP lines?
Yes, absolutely. So for people who don't know, plasma is a component of your own blood. It has in it a lot of basically cells that trigger our body's natural inflammatory response. And so when plasma or PRP started coming into medicine, it mostly started with orthopedic surgery and wound healing. So that's where the evidence-based studies, started. And it crossed over into aesthetics because again, the whole theory is that we're able to grow whatever cell, we need to grow, whether it's skin cells, liver cells, collagen, elastin, all those things. So at Plasma Med Spa, that's what we mostly focus on. And that's what our specialty is. So we do offer PRP injections for joints, which is what I did in orthopedic surgery, ligament, tendon tears, like rotator cuff, tennis elbow, golfer's elbow. I am also trained in all the vampire procedures through the Cellular Medicine Association for the vampire facial, vampire facelift, the breast lift, the O shot, and the P shot. And then we also do PRP for hair restoration. And then the other procedure that we do, and I'm actually the only one in my area that does this, is a PRP filler, where we can take plasma, heat part of it, cool part of it, and use it instead of traditional HA fillers.
Wow, that's I did not know it was so extensive. A lot of
Yeah.
what I hear around PRP is around sports medicine. Athletes are getting these treatments on their
Mhm.
joints, especially. So that's great that you are seeing really great benefits of that transition from what was traditional medicine into a more aesthetic space. That is phenomenal. Um, Now, as you've integrated this more into plasma med spa and the aesthetic space, can you tell me what your patient journey usually looks like for something like this? What's a consultation look like? How can they learn more about this treatment and how it'll benefit them?
Yeah, so I'm a relatively new practice. I opened exactly a year ago this month. So,
Congratulations.
thank you. It's been interesting.
Yeah, yeah.
So, a lot of my patients either come from patient referrals, or actually, I do get some from social media. So, really educating, right? Like trying to educate people on social media in like a 15, 30-second time frame is very difficult.
That's super
Um,
hard, yeah.
Yeah. So a lot of it is word of mouth. So people come in saying like, "Oh, I want plasma," but there's so many different uses for plasma, and not everyone is a good candidate. So the first thing that I do is I do a full medical history assessment, and physical assessment to see if the patient is a good candidate. So, again, everyone's plasma is different. So mine is different than yours, is different than the next person's. It's really hard
Sure,
to predict, um, you know, exact outcomes with plasma because the product that we're using is not consistent. But
sure,
there are obviously, things about patients that would exclude them from having plasma, like, if they have, active cancer or they're heavy smokers, right? Their plasma is not going to be as great. I do have one really good example actually that I'm going to use. I had a patient who was 84 who came in because he had Achilles tendonitis, which is inflammation around the Achilles tendon in the ankle. And
sure.
so, he came in wanting a plasma injection. He'd had multiple steroid injections and he found me on Google. And I said, you're 84, your plasma is definitely not what it was when it was in your 20s, 30s, 40s, 50s,
Sure.
right? I mean, he
Uh-huh.
wasn't a smoker, but I said, listen, I cannot, in good faith, I cannot say that I'm going to be able to do this plasma injection and have it be, like a good outcome, right? So if you
Mhm.
were in your 40s, I would say, yeah, definitely try. But he wanted to do it anyway because he was kind of, at the end of his rope, so to speak. And I called him 2 weeks later and he had no pain and he was so happy. And it just made me feel really good because, at the end of the day, like my goal is to do the best thing for the patient. And even though I didn't think it was going to work, it worked anyway, which was a really nice, pleasant surprise. But yeah, so I definitely try to make sure that the patients understand, right, like that the result is not guaranteed because I'm not looking at their plasma with a microscope, but definitely trying to rule in and rule out who would be a good candidate so that if they're spending their money, there's a good chance that they're going to have a good benefit.
So, within plasma and PRP for the aesthetic space, is there an ideal patient? Do you find that the treatment works better for some patients over other patients? Can you tell me a little bit about that?
Yeah, I mean, some of it again is patient selection in the sense of like, right, I don't want them to have a lot of comorbid uncontrolled conditions like uncontrolled diabetes, right, uncontrolled heart disease, um,
Hmm.
high blood pressure, right? Like, I mean, obviously uncontrolled in a sense. Smokers, right? Like, I normally don't recommend to do this on smokers. For example, I did an O shot the other day on someone who vapes. And I said, listen, the first thing that I would do is stop vaping,
Huh?
right? Because if you're
Yeah.
having a problem, right, like one of the first things you want to do is stop smoking, stop nicotine. And I get it, right? Like these things are very difficult to do, right? And it's a form of addiction, and I understand. So I understand that
Hmm.
people look for ways to do things that don't involve, lifestyle changes, which is part of my job.
Hmm.
But counseling patients on lifestyle changes, right? Because again, just like anything, I always tell people plasma is just like anything else, like Botox fillers, anything really in longevity, wellness, aesthetics is not a one and done, right? It's just like brushing your teeth. You can't brush your teeth one time and have like clean and great teeth for the rest of your life. So it's maintenance. It's also lifestyle changes. So
Yeah.
again, just making sure that they're compliant with the treatment, they're compliant with, for example, when you do PRP, right, you have to stay off of the joint or whatever for, a little bit just to give it some time for that inflammation to really work. You can't be on anti-inflammatories, no NSAIDs, no aspirin products, right? So just making sure that we're selecting the patients knowing that they're going to be compliant, knowing that, again, you can't guarantee, right? But
Sure.
knowing that they're motivated or at least trying to motivate them to make those lifestyle changes so that they're able to get good results. Because at the end of the day, it's also right, like my credibility, my honesty. If I do something for someone that costs a lot of money, right, like the
Hmm.
end result is also dependent on me, but also on them. So it has to be
Sure.
a partnership.
No, absolutely, absolutely. So we talked a lot about plasma
Yeah.
and PRP. Uh, what other things are offered at Plasma Med Spa that people should know about?
So we do aesthetics like Botox and fillers, hyaluronic acid fillers, chemical peels. We offer facials,
Uh-huh.
IV vitamin infusions, and I think that's it.
Okay, no, that's great.
Yeah.
You have a pretty wide breadth of offerings to different people, right? That's fabulous. Um, uh, Along those lines, right, being able to offer a wide breadth of treatments and having specialties and in areas, what would you say is your competitive edge? What makes Plasma Med Spa better than another med spa down the street from you guys?
Yeah. I think that part of owning a business, other than like your drive and right, like your dedication to excellence, also
Hmm.
has is about two other things. One, I would say relationship building. I really look
Sure.
at my practice as a relationship, right? Like I build relationships with other people, I build relationships with other businesses, I build relationships with my patients.
Uh-huh.
Um, and so and it's me, it's just me.
Okay.
So, right, like, so when a patient is texting me at 9 o'clock at night, it's me that's answering. When they're
Wow.
texting me at 6 in the morning and I'm responding, that's me. And I know that this is not something that's always sustainable and always for everyone, but for me, like, I have two little kids. And for example, if I'm reading them a story and I get a text from my patient, like my brain is like, you must answer now.
Yeah.
So I really do have that drive to be connected to my patients. So again, very personalized service, but also, just doing everything ethically. To own a med spa and to run a med spa in this day and age is very expensive to do it legally.
Hmm.
So, but it's the only way that I sleep at night. So making sure we're getting all our products from, Allergan, MERS, just the pharmaceutical companies that are FDA approved in the United States, making sure, we're getting good products that are tested and evidence based, making sure we're staying educated, so continuing education, continuing to improve my skills as an injector, really investing in the quality that we provide to our patients. I think that's what really sets us apart.
That is awesome. It's I know a lot of people who open med spas, and I'm not saying this is everyone, but a lot of people open med spas and then just hand it off to someone else and say, good luck to you. And
Yeah.
so, that's never a great experience. So the fact that you are putting in so much effort, right, to not only maintain your education and being the best that you can be within the practice, but also building those relationships with your patients. Those go a long way in not only helping you retain patients for a long time, but also growing your customer base, your patient base, right? That's really what this is about. So now, because we are a marketing agency and you are on our podcast, we're going to talk a little bit about marketing, if you don't mind.
Let's
Um,
do it.
all right, cool. So, you mentioned earlier you get referrals from existing patients, from new patients. How else can people find you? What else do you do to kind of put you guys out there? You have patients coming to you from Instagram, from I'm assuming TikTok and or Facebook. It looks like you host events every once in a while. Uh, you
Yes.
know, Tell me about what people can do to be able to find you and learn more about Plasma Med Spa.
Sure. Let me just say that when I opened this business, since you guys, own a marketing agency, I very much underestimated marketing. I just thought I'm good at my job. They will come.
Sure. Yeah.
And they did not.
Yeah.
Yes, yes, exactly. Yeah. So I've learned a lot because again, it's just me. So I learned a lot about marketing and again, I will keep reiterating relationship building as one of the main sources of patients. I'm part of
Hmm.
a lot of networking groups. So, through the Chamber of Commerce, groups like BNI. I'm actually part of the Rotary Club in my local community. So I do community service and other events, and I'm involved in other ways. But I will say that that has, helped me market myself as well.
Good.
Because I guess,
Good.
people get to know you, they trust you, things like that. I also do events at like gyms and other local businesses to market the business. Um, Facebook, Instagram, TikTok. I do have some patients that come from that just because they're able to see my work.
Sure.
And then I actually, I'm a consumer of businesses in the area. So when I opened up my business in Weston, Florida, right, like I moved all of the things that I consume to local businesses because I wanted to give them my business. So I started taking my kids to the movie theater in my plaza instead of the one by my house, like I'll go to the restaurants in here instead of closer to our house. I now go get my hair done here locally, right? Because I know what it's like now to be a local business owner, and so I'm trying to support other business owners, with things that I do in my day to day as well.
Okay. Good. Um, how often are you doing things like, I guess, events or, I guess, seminars or workshops? Or how often do you usually do those things?
Once every 2 to 3 months.
Okay.
I just had one for Valentine's Day. I'm having
Okay.
one on Tuesday because it's my 1 year anniversary. Um, but yeah, I try to do it like every 2 months. We offer the thing that I want to do, and this is really my vision for my business, is like build a community. So less of, like events for, even though right at the end of the day it is a business and there is some sales involved,
Yeah.
just trying to build a community and have people like want to come to interact with the community that we built. So that's my vision ultimately, marketing wise.
Yeah. Yeah. No, I respect that absolutely, right? That's good that you have a plan in your head of what you're trying to execute on. But as we all know, sometimes that's easier said than done, right? So,
Absolutely.
um, yeah. Okay. Um, what would you say the most difficult part of marketing is for your business?
I think as a medical professional, it's hard to put on that marketing hat, right? Because
Sure.
I'm embedded in, doing a consultation, doing an assessment. It's really hard for me to. Right, like, so I'll just give an example. So if I do a consultation or I meet someone and they're like, "Oh, well, what do you think?" Right, like of my face, or what should I do about my face? It's hard for me to be like, "Well, you need to come in for a consultation."
Yeah.
Or you need this, and they're like, "Yeah, well, and then they talk about price. So I think marketing wise, establishing like a premium brand is really difficult because at the end of the day, it's hard for you to focus on money and sales and marketing yourself in the sense of, a product versus like the service that you give, right? Because, for example, when I worked in ortho surgery, right, it's like a set, right? Like everyone pays like a copay or whatever.
Hmm.
They're not like sitting there arguing with you about like your per unit cost for Botox.
Yeah.
So I think that part is really hard for me to say, okay, well, this is why you're paying this price, right? Because it's hard for me to disconnect the medical part of myself versus the marketing part of myself, right? Like to market myself as a premium injector or whatever you want to call it. That part is really difficult for me because I don't come from sales, I don't come from marketing, right? I come from medicine.
Yeah. Yeah. No, that's
Yeah.
true. And building a luxury brand is not easy, right? That just comes in time. And it the things I can see that you are doing look to be really well done, right? Your social media game is pretty well on point, right? You have a lot of fabulous reviews on
So,
Google. Yeah,
yeah,
like
I'm proud of
yeah,
those.
no, and you should be. Like it's not easy for people to find a med spa that they really enjoy going to and a provider that they trust. And that seems to be what you have built in this very short time that you've been open. Um, so kudos to you on that. That is amazing to do. Um, yeah. So I noticed along those lines on some of your social media posts, right? It looks like you are being super authentic and super natural in that environment, um, which is not easy to do by any
No.
means. Are you using anything to help you build that content? Are you using like AI to help with any of that, or any
I have a
particular apps that are
marketing
helpful?
team.
Okay,
So
okay,
they will come and shoot my content for me.
okay.
So some of the ideas come from me, some come from them. To be completely honest, it's hard for me to do more of the like funny, those types of
Yeah, the
videos. I'm
trending
just
content.
not
Yeah,
good at it.
yeah,
And it makes me uncomfortable.
sure.
Um, but I'm glad that it's coming off as authentic. I mean, clearly something's going right on that part. I feel more comfortable doing the more educational, like the actual patient care part that I feel more comfortable doing. But yeah, it's definitely, something that I never really imagined that I would be doing in the sense of, like social media and stuff like that. But I think, right, like with, modern marketing, it's just something that, we need to do and that people connect to. So I guess that's good, right? That people are able to connect to it. So I'm happy about that.
Good, very good. So, okay, great. That's awesome. I guess to kind of wrap up our conversation here a little bit, what are your future plans for Plasma Med Spa? What are you looking to do over the next couple of years? And how do you see the treatments that you're offering evolve over that time?
Yeah, I mean, I think I would like to stay on the forefront of, wellness, anti-aging, um, you know, for the whole body, but also in aesthetics. And that also has to come right with growing my patient base and being able to, add on treatments. Um, that I'm able to, basically help my patients with whatever it is that we're doing.
Hmm.
So yeah, I mean, I definitely want to grow in that sense and basically improve my education in those areas. I am, like for example, I went to AMWC, which is the Aesthetic and Anti-Aging Medicine World Congress this year.
Hmm.
Um, and there's a lot of like new treatments, right? Exosomes, things like that are
Yeah.
coming to the market. I'm more on the conservative side in the sense that like I have to make sure that it's legal, that I can do it well, right? That I know what I'm doing, and that it's going to bring a benefit to my patients. So I think I'm a little more conservative, and then I look for those evidence-based studies, make sure that everything is well tested and safe and legal. So yeah, I definitely think regenerative medicine is exploding. A lot of people are interested in it, and so that leads to funding for more research. And so I'm hoping that a lot of these new things that are coming out are going to be, well tested, researched, and proven. And if they are, I'm happy to bring them onto my practice.
Great. That's great. That's
Yeah.
awesome. So, okay. So, uh, I guess thank you very much for hanging out with us for a short time here, Tal. People can find you at your website,
Yeah,
plasmamedspa.com, and
absolutely.
all of your social handles are the same, right? Plasma Med
Yes,
Spa, one word.
correct. Yep.
Okay, great. Um, well, like I said, thank you very much for hanging out with us. Is there
Thank
any
you.
last thing you would like to say before we hang up here?
Yeah, thank you so much for having me. I always enjoy talking and educating. So I'm also a professor, so I think that's where it comes from.
Well, you
um,
are great at it. I will tell you that.
you, yeah, so I very much enjoyed it. Thank you.
Okay, cool.